All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello, South Florida and beyond, and welcome to the You and Your Doctor Living a Longer and Healthier Life show. This evening we're going to be talking a lot about orthopedic surgery. We do talk that from time to time, and we have Dr. George Botelho, orthopedic surgeon in Boca Raton, the Injury and Spine Institute, right on Glades Road in Lyons. I'll never forget, because that's the intersection I pass through every day. And we're going to be talking a lot about the back today and back ailments, and go into a little bit more, even to talk a little bit about PRP injections, stem cells, and some other topics. So last time we talked a wide range of orthopedic care. There's a story in the news, and it just is going on and on. It's actually mesmerized me. I just read an article in the Washington Post about Tiger Woods' return from back surgery. They're saying it's almost miraculous. That's what their headline was. And I wanted to have an orthopedic surgeon on this evening to talk a little bit about that. So we welcome Dr. George Botelho. Dr. Botelho, welcome back to the program. I think that this is your fourth time, so you're right up there in my rankings of doctors in the lead for being on the show. No, I'm really happy to have you.
Thank you.
Back again. And, yeah, I wanted to talk about this amazing surgery, because as we know, one thing about Tiger Woods, he's had a lot of injuries. I researched this today early. PGA.com actually has a list of all his injuries. It's amazing. You know, there's only been 4 back surgeries, but he's had a ton of ailments. I didn't know about all the Achilles tendon, the left knee issues. One time he had 2 tumors removed that were benign from his left knee as well. But what everyone is talking about is back, because we all know, watching him, he just wasn't right the last few years. In fact, a lot of people said he'll never win a major again. So one of the things that he had done, his last back surgery, which I believe was in April 2017, is called an anterior lumbar interbody fusion surgery on the L5 and S1 vertebrae. Is that fusion surgery, and what is that, and what's going on there, and why do you think it worked now? That's a big question for you to start out the program.
Actually, it's a great question. There are many different back surgeries, many different problems that occur in the spine. And when someone injures a disc in their back, which is very, very common, you can have a herniated disc, you can have just an injured disc. And injured discs, even though they're not herniated, could be very symptomatic as well. A person with a herniated disc could also have sciatic symptoms, because it could pinch a nerve, and the nerve is actually part of the sciatic nerve. The sciatic nerve travels down the leg, and hence the reason why people have leg pain when they have a pinched nerve. But even, again, bulging discs or injured discs could cause a lot of pain. And the typical patient will come in and they'll say that they can be working all weekend long in the yard, carrying bags of concrete, or even carrying bags of fertilizer, and their back is only sore. But then they'll sneeze or they'll bend over at work, and all of a sudden their back will be out for several days. So there's a whole constellation, a whole gamut of different symptoms that arise because of discs. And each of the discs are very different in the back. In fact, the L4-5 disc, which is between the fourth and fifth lumbar vertebra, second to last disc that's normally found in the back, is the most commonly injured disc. But the disc at L5-S1 is the most difficult to treat. And it's difficult to treat because the back has a normal curvature that should be found in almost everybody. It's called the lumbar lordosis. It's a curvature that points towards the front or towards the abdomen. And what happens is at L3-4 and L2-3, the disc is almost parallel to the floor. But as you get into L4-5, it inclines downward a little bit, and L5-S1 is inclined at about a 20 to 30 degree angle. So the disc is not only under compression or under load, it's also under shear because it's sliding as well. So the L5-S1 disc is much more difficult to treat. And these things have to be taken into consideration to get the healing to work. And an anterior lumbar interbody fusion is a fusion that's done on the anterior portion of the disc. And if you were to divide the spine into three areas, there's the front half or front 2/3 of the disc. Then there's the back half as well as a ligament. And then you get into the spinal canal and the rest of the spine in the back. So there's almost three columns. So when we talk about the anterior column, we're actually talking about fusing the front of the disc, and the most common approach is from the abdomen, from the front.
Wow.
Which is seemingly a crazy way to go. But what's important is when you go from the back, you have to go past the spinal cord and you have to go past the nerve roots. And they're prone to injury because you're there and having to move them out of the way.
You don't have a lot of, everyone's anatomy is different, but you don't have a lot of space to work with,
You
right?
don't have a lot of space, but there's another problem, and that is if you're trying to fuse the disc because you don't have a lot of space, you can only put in implants that are so large.
Yeah.
So you're putting in a smaller implant to fit through the space so you don't injure the disc, so you don't injure the spinal cord, you don't injure the nerve roots, but it has a very small surface area. And because of that small surface area, it's harder for you to achieve a great fusion. Now, you can put two in, but or even three, which is how we've tried to compensate for this problem coming through the back. But you can also put an expandable cage in. The expandable cages allow for larger surface area, but they're more complex and they're harder to put in. But the whole idea is to achieve a fusion, especially at L5-S1, because it's under an oblique angle and under shear, it has a harder time to fuse or a harder time to heal. So an anterior approach, or coming in from the belly, it sounds like it's very risky, but what we do is we actually move the abdominal contents to the side. We pull them aside because the intestines and the other elements of the abdomen are less bruised, less injured, if you will, by pulling them off to the side than the nerves would be when you pull them off to the side and when you come from the back. Not only that, but once you move these abdominal contents out of the way, you have exposure to the entire disc, where the disc is actually protecting you from the spinal cord and the nerve roots. They're on the other side.
I see. That's the anterior way. Yeah.
You come from the front, you can expose the entire disc. You can remove the entire disc. You can take off any disc herniations, but then you can put an implant in that has a much larger footprint, we call it, a much larger surface area, which is more stable. And because it's more stable and it's more solid, the likelihood of achieving a fusion is much higher without the risk of damage to the nerves. Now, what is the downside? Well, you move all the abdominal contents aside, so the abdomen and the intestines have to kind of recover, but that generally takes the order of several days. Okay, not weeks, not months, but only days.
Unbelievable.
Okay? You have a little bit bigger a scar, but it's not a big scar. The scar is really only probably about 4 inches long, as opposed to a back incision. Okay, a back incision is going to be 1 to 2 inches long. So it's a little bit longer, but you can put in a larger implant, a greater surface area. It's more stable and more likely to heal. An anterior lumbar fusion does great, but they can only really be done at the L4-5 level. L5S1 is not easy to do because the pelvis gets in the way, but it can be done with certain types of implants. And maybe L3-4, but then you start getting higher and it gets riskier because of the aorta, because of the inferior vena cava.
The anatomy, yeah.
The anatomy starts
Definitely.
to change at each level. So, but in L5S1 and L4-5 fusion, because of the obliquity of the angle of the disc, they do so much better with the larger implant, which is exactly what they finally did in Tiger Woods to get rid of this problem.
Yeah, they sure did. And
Yeah.
we're here with Dr. George Botelho, orthopedic surgeon right here in Boca Raton Injury and Spine Institute. I'm going to give out the info here in a second. When you say fuse, and I know I've asked you this before, what is actually the fusing going on? Is that bone to...
Bone to bone.
Bone to bone. Okay, being fused.
You have a vertebra or a bone. In this particular case, Tiger Woods, it was L5 and bone at the S1 level with the disc in between. But when the disc is abnormal and no longer functioning properly, that disc could release something called cytokines. They're highly inflammatory to the spinal canal. And then the disc degenerates, it loses water, and it no longer functions as a disc absorbing shock. So at that point, there's no great disc replacement that exists for the lower back and lumbar spine, especially at L5S1, because, again, the obliquity. So we fuse them. We take out the disc in its entirety. We restore the height of the disc space so all the ligaments are under the appropriate tension. And then we put an implant in, most commonly titanium, because the body likes titanium. Body grows to titanium. It has a similar charge. Believe it or not, everything in the world has what we call a galvanic charge. It has an underlying charge because it has atoms and electrons. So it has an inherent charge. Ironically, sheetrock on the wall has a galvanic charge. You can actually measure that. Oh, yeah. Everything in the world has a charge because they're made up of molecules and atoms. Titanium is liked by the body because it has a similar charge. And many years ago, when the studies were done between stainless steel and titanium, they actually took the implants out of the body once the person had passed away, and they used a special diamond cutting blade, and they looked at it under the electron microscope. When they looked at it under the electron microscope, they found that the bone grew onto and into the titanium. But with stainless steel, it actually had a gap in between. And that's why stainless steel screws get loose when people have plates and screws. Titanium does not, because the body locks onto them. They're actually difficult to remove because the body locks on so well. So titanium is great for the spine because hopefully you never have to go back.
Yeah,
that's why this
definitely.
is finally working for Tiger Woods.
Yeah, and it says in the article that I referenced most likely with titanium.
Yep.
Dr. Botelho, thank you so much for explaining that because it's in the news again because the PGA Championship's right around the corner. I think the 2017 champion won't be playing. I think he's having wrist surgery. I mean, the ailments in golf. When I looked up Tiger Woods injuries, and there's a page both on ESPN and I think it's Golf Monthly and PGA.com. So just the headline, 23 years of a painful journey for Tiger Woods, 22 career injuries, and we referenced a couple of them. And this guy has had some serious injuries, and athletes in general have injuries, but, you know,
Sure.
weekend warriors like you were referencing have injuries. I mean, they hobble, walk, or stumble into your office, I'm sure, on an everyday, but because sometimes on the weekend I get a little out of control trying to do too much, and I feel that, some of that pain that you were talking about. But we're here with Dr. George Botelho, orthopedic surgery in Boca Raton, the Injury and Spine Institute. They're right on the corner of Glades Road and Lyons Road in Boca Raton, 9033 Glades Road, Suite D, Boca Raton, 561-483-4111. Website injuryandspineinstitute.com, and a lot of the questions I'm going to ask Dr. Botelho, the answers are right on that great website. One of my favorites, I always mention it, it's got a great design, ton of info. Those are the things I really look for as a consumer. So hard to believe we've already ripped through 15 minutes, but on the other side, I'm going to ask Dr. Botelho about his other areas of interest. He does do a lot of back surgery, but some of the other things he does on the You and Your Doctor show.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Hello, and we're back with Dr. George Botelho, orthopedic surgeon here in Boca Raton Injury and Spine Institute. It's injuryspineinstitute.com. We were talking a lot about back surgery, actually back fusion surgery, because it's in the news. Tiger Woods, had the surgery in April 2017. It was his last of 4 back surgeries that he had at the time, and then 2 years later, almost on the dot, he wins the Masters, which, if you watch golf, the Masters is like the Super Bowl. I mean, there's just nothing like it. But British Open a little bit, and PGA as well. All the golf people are going to rip me apart on that one. But the Masters is the Masters. It's awesome. But Dr. Botelho actually does that type of surgery Tiger had. It's the anterior lumbar interbody fusion surgery. It's he was telling us it's specific in the L5, S1 vertebrae region. And check out the program on allcountyhealthcare.com. Dr. Botelho puts it up on his site, injuryandspineinstitute.com. Actually, it's injuryspineinstitute.com, all one word, or on Facebook on All County Healthcare Incorporated's Facebook page as well. And I see all the viewers there on Facebook. Thank you. And if you have any questions, you can let us know there, or 888-565-1470. So, Dr. Botelho, you do that surgery. You also do revision surgery as well for all types of ailments, things that need to be improved for whatever reason. But you were telling me, it's not all surgery. Only surgery is like a small percentage of your practice. You have a lot of non-surgical treatments.
We do. Patients don't come to me for surgery. They come to me for diagnosis and answers. I had a patient today who has a neck issue, and she's been struggling with it for about 3 years, and she's still not ready to have surgery, which is fine. I saw her for the first time today, and I understand nobody wants to come to my office to have surgery. They want to come to find out what it's going to take to be well or to be better. And some of those patients want to be 100%. Other patients want to be 25 or even 50% better. But it's a matter of choosing what is reasonable for the patient. And we find ourselves having to treat patients conservatively first, helping the patient to get better. And if not, we then, shall we say, increase our tempo. And we might become a little bit more invasive if everything else is failing. But at the same time, when it comes to anything surgical, when it's time to talk surgery, it should be something that is definitive, not something that's going to help, but hopefully solve. And this is what happened in some ways with Tiger Woods. The whole idea in the beginning was to try to do the least and getting the maximum result. The only problem is this is a high-level, high-energy athlete. And all the time that he was down because of these, shall we say, incomplete treatments, trying to avoid major spine surgery, actually took him out of the game literally for much longer by delaying the definitive treatment.
Yeah, I know. And he even said that he was having so much pain he couldn't sit down to eat dinner with his kids.
And that's very typical.
Wow, that's if anyone's having that, that's a quality of life issue, and it's definitely time to see one. And you know, we have great physicians here in South Florida like Dr. Botelho. You know, visit him, injuryandspineinstitute.com, and get that better quality of life, because that's no way to live. And that we're talking about one of the richest athletes in the world living like that, and he was just in total pain. And I believe personally it brought on some of that depression as well, because it's tough to live like that.
Well, if you think about some of the medications that are now used for chronic pain, they're actually antidepressants.
Yeah.
So they were originally created as an antidepressant. We actually found that they're better used to treat chronic pain. A great example, not to tout a product, but Cymbalta was originally created to treat depression. And lo and behold, it's now being used for chronic pain, and back pain is its primary indication.
That's great.
Yeah, there's a lot of overlap
crossovers.
There's a lot of overlap between. There's a lot of patients who have chronic pain that manifests with depression, and vice versa. Patients with chronic depression actually have chronic pain or develop pain as a symptom. There's a lot of overlap.
And you treat a little bit of everything. I know we started on back. We're right here in the swing of golf season. I wanted to get that out there. Kind of in the golf capital of the world here, in my opinion.
Absolutely.
But last time, we talked about a wide range of orthopedic care you provide, injury management and treatments for ailments of the wrist, hand, upper extremity, shoulder, elbow, hip, and knee. And I described you as an expert of the musculoskeletal system, which you came back and told me it's from the chin to the toes for sprains and broken bones.
That's it. That's
should coin that phrase. I'm telling you, that's awesome. That is great, because it really explains it to someone who's not in the medical field.
Yeah.
I mean, because like sometimes when I see, and I'm in the medical field now 6 years, but just in the PR side, but sometimes when I see orthopedic surgery and then it says, you know, this doctor is a hand specialist, but I'm not thinking if it says hand specialist, I'm not thinking that they can maybe do other things, but you yourself, it's from the chin to the toes. I mean,
a lot of orthopedic surgeons out there are part of large groups, and therefore each doctor specializes in a particular thing. When I was in training, I had such a robust and complete training. And when I first started practice, I went down to the Florida Keys. And in the Florida Keys, the demographics are such that large groups can't make it. They don't survive. And specialists can't survive because people will go to Miami. So when I was down in the Keys, I was forced to continue what I learned. And I prefer to have a very diverse practice. And there are those things that I like to do more than others, but there's quite a few things that I do quite frequently. And because of that, I just kind of am more of a general orthopedic surgeon, but I still do a lot of hand work and arthroscopic work and joint replacement work. And again, even spine work from the neck into the lumbar spine, including injections and other things as well. So I kind of like diversity.
Yeah, we as human beings, we wear and tear down that body as well. Boy, when you were in the Keys, you must have had some interesting characters, because all I can think of is like the show Bloodline and the Rayburns. And I've spent a lot of time in the Keys because I'm from Florida, and there must have been some interesting injuries and people to walk through those doors. But that's great, because you got to get that experience, and it's taken where where you are today. And what is the age range of your patients? I always ask that because, is there do you start at a certain age, and nowadays all the way up, because people are living over 100, right?
Oh yeah.
I'm sure you have a couple.
Well, I've
older patients.
I've done a knee replacement in a 95-year-old woman.
Whoa.
And I did a hip replacement because of a hip fracture in a 106-year-old man.
Oh wow, that's up there.
Those are the two highest. I remember the 95-year-old woman had such a crooked knee. She was from Jersey, and she would drive down to the Keys every single year, but she was having a hard time walking, and everybody said she was too old to undergo surgery. But yet she was pretty healthy. And when we took her through the rigors of a medical evaluation, she did quite well. And she consented to the surgery, and she did great after the surgery. And I continued to see her at least 3 more years that she drove from Jersey.
Wow.
At least 3 more years that I saw her.
A 109.
So
That's
that
awesome.
was pretty impressive. So, there is quite a few things that I've had the pleasure of treating. I even treat children. Generally, I like to say the cutoff is about 6 years of age and older, but there's some exceptions to that as well.
Yeah.
But generally from 6 to, well, so far 6 to 106 so far.
We got about a minute left. Hard to believe. A great conversation as always. Dr. George Botelho. If you're wondering what types of insurance he takes, InjurySpineInstitute.com. They're all listed there. His board certifications, his medical school, etc. as well. It's InjurySpineInstitute.com right here in Boca Raton, 9033 Glades Road, Suite D, the corner of Glades Road and Lyons, 561-483-4111. Dr. George Botelho. Thank you so much. I can't wait to have
Thank
you
you.
back on. It's always
Thank
a
you.
great time. And we'll see you next time on the You and Your Doctor show.
Thank you so very much.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life. The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station, its staff, management,